You're going to have to let me know if that works. Once again, thank you for joining us. I cannot thank our community enough. Over the last 2 weeks, we've been preparing you. We've been talking to you about the strategies you can do as an individual, whether it was frequent hand washing, social distancing, staying home when you're sick. And now we're moved into some community mitigation strategies. We started with reducing group sizes and community gatherings of 25 or more. We dropped it down to 10 as we were adhered to the governor's directive regarding restaurants and bars moving to, takeout services so we could reduce again the social gathering. And then we moved, to some of our personal services where we knew they could not adhere to the social distancing recommendation. So as we moved through this, we did this with the intent that we wanted to flatten that curve, that our goal was to have as few cases in Winnebago County as we could possibly have. Unfortunately, we continue to have cases. I'm here to tell you that we had, as of today, there are a total of 3 cases. So we received notice of 2 additional cases in Winnebago County. One individual in their 30s and another individual in their 40s. So similar to what you've been hearing, this is not just a disease of those at risk in the higher age range. They are both residents in the city of Rockford, and after today, we will not be having a conversation of where they reside in the city or the county, because now you know it's in our county. All of the cases that we have are suggestive of community transmission, meaning they did not have a risk factor when they presented, but they did present to a healthcare provider with signs and symptoms, and the healthcare provider took the necessary action to test them. So it's important to understand that this now is our community. We are going to continue to, as we've said, as we now have the order to stay at home with the idea that we can flatten it even more. As you heard today from the governor, we heard that there were more than an additional 163 cases throughout the state. We've heard now, as of yesterday, throughout the nation, it's in every state. And our goal now is to try and reduce those cases to as few as possible. And so these strategies now, this is a stronger community mitigation strategy. So from just simply limiting the size of gatherings, closing schools, closing certain types of businesses, and I shouldn't say closure, but suspending them until we can then get back to our routine. But now we're asking people, they need to stay home. We talked about staying put, and now we have the order from the governor to stay home. We really need to kind of work on this as a way so that our healthcare systems can begin and continue to treat those most at risk. We've had difficult conversations about how do we test as many people that need testing, how do we prepare for the next phase of individuals who might need care in our hospital systems, and how can our clinic systems and those around us support us. The Emergency Operations Center backs us up on all of these discussions and conversations about how do we move that forward, and we can't thank them enough as they prepared for how do we feed students during the school year that normally get their foods from our school system. So we understand how disruptive this is, but we've said from the get-go that if we could disrupt the transmission, we would take the disruptive means necessary. So to give a little background, I know we always talk about the numbers. So we talked about we have 3 positive cases in total in Winnebago County as of today. We have done 41 what we call persons under investigation. We have done 121 tests through the private laboratory for those systems that are reporting to us. Total of 3 positive. We've received 42 negative results from the systems, but we have 117 tests still pending. So we expect those to continue to come out over the next few days. We will continue to test individuals, but our healthcare systems want to remind all of you, they will prepare for you, but please call before you go in. Individuals with mild symptoms may be asked just to stay at home and not have a test. Others may be brought into the healthcare system so they can further evaluate and determine testing. But it becomes important to stay in communication. So that stay at home is really a directive for all of us so that we can make sure that our healthcare systems are able to respond and care for the most vulnerable. So again, thank you for getting the information out. Try and keep those rumors from spreading. about, I heard so-and-so, I heard this and that, because every single one of those requires investigation from the health department, and it takes us off critical activities. So for every case we have, we must interview not only the case, but all the contacts, and then track back and determine what is their risk. So your support and really stopping rumors as both reporters and as the community is extremely important. Please know that we're ready for you. We are responding in every capable way that we can, that our healthcare systems are preparing to respond and have been responding, that as the situation changes, we are changing our strategy so that we can best stop this spread of COVID-19. So with that, I would like to introduce Mayor Tom McNamara to provide the city perspective.